My name is Marissa. I am a lead patient coordinator at La Jolla Cosmetic, and Dr. Salazar and I are going to react to some videos today.
Triplets. Oh, triplets.
Oh.
3? Does anybody ever ask you for a 3-boob surgery?
Nobody ever wants 3 boobs. Usually we'll just remove a 3rd nipple if we need to.
I think 2 boobs are enough.
Yeah.
Yeah, 2 boobs are enough.
Do you think you can add a 3rd boob if somebody requested for a 3rd one?
What, can? I mean, technically it's doable, but no, I would never add a 3rd boob. And I don't know, after looking at that video, I was wondering, have you received any out of this world requests then?
One that I can think of off the top of my head was on a call. A patient asked me about a tummy tuck, and then as we were talking about it, she said, do you need a belly button? Is it necessary to have a belly button?
Belly button is so natural. It's natural to have one. Technically, you do not need a belly button to live, but in order for your body to look proportionate and to look natural, you need a belly button. We all have belly buttons. We normally, bring the belly button out through a new window. We actually deliver a well-defined belly button, and it looks much more natural, and patients love it.
And if you guys didn't know, Dr. Salazar has a very beautiful technique on his belly buttons to still make them look very natural.
I take my time, I would say, yeah. I do take my time.
How many implants do you have total?
I have bicep, tricep.
Okay.
11.
Teres minor major as a single piece.
13.
2
in the
bicep
quad,
implants.
2 down
That's
below.
21.
So if you're putting an implant for like a muscle, like how he did right here, where would you put the incision at? Because you want to make your incisions like as minimal as possible.
No, it's really hard. It's really difficult because you're going to try to hide it. So you're probably you're going to put it in the back, but then like those patients actually want perfect bodies and they want to look good from all different directions. So you have to have an incision. You're going to try to keep it as minimal as you can.
Yeah.
But it's also a very difficult area because there's a lot of motion there. So you potentially can get like bad scarring. You can get like what people call keloid.
Which are like those super thick ones.
It's very thick and very noticeable.
So you do the HD lipo for like the abdomen and
Very
like
frequently.
yeah, so you're ab etching. Can you ab etch on your arms or your thighs too, you know, for that more muscle defined look?
So basically anywhere where there's a muscle, we can definitely accentuate it. And for instance, we do a lot of the chest HD lipo as well,
Right.
in which you get the pectoralis major muscle, and then we edge it on the side, edge it underneath, and then
Right.
create that aspect of having a stronger chest, and then even fat grafting on top of it. We could do that on the deltoid. We could do that for the biceps, for the triceps. That's very doable. And then that's through very small, tiny incisions. So it's easier to hide those than to hide an incision for a true implant.
Oh wow. I would have never even thought to even ask about that, honestly.
I think it's a matter of if you think that's the right procedure for you, definitely we could deliver it. All right, next video. Okay, he has some facial markings. Oh, he's putting filler.
Oh.
Oh, okay. Definitely she has some filler, but...
Can that really just be filler? Because if that's the case, then we can just all take a trip to the med spa, right?
I would think so. Yeah, I would agree with you, but hard for me. I'm going to be a little skeptical with this video. Of course, she can benefit from some filler. She got some filler, but even the markings, they tell me that there's also some pulling vectors. I'm going to venture to say that can be achieved with fillers and also something that pulls it. And for that level of pulling, I would go with some surgical intervention. I think that there's going to be some incisions there and some removal of extra skin.
So it's too good to be true, and it is.
I feel so. I think it's too good to be true. Now, the other thing is, if all that is being achieved with filler, which I highly doubt, you would need a huge amount of filler.
Well, even with filler, if that's just one time, and if she were to have to do that with filler at least, every year and a half, 2 years,
Right, or every
might
year,
as well
every year
just
and a
get
half.
like a facelift
Oh
at
no,
that
absolutely.
point.
Oh yeah, absolutely. But yeah, she had something surgically done.
All right, next video.
Let's do it. Right, like a marking in the midline of the I knew that they were going to do that.
Oh no. My instant thought is when you're eating, you're just gonna bite your own tongue.
You're going to bite your own tongue. You really need to relearn how to chew food with that, and also even how to phonate, meaning how to talk. And you got to get used to having a bifid tongue. I mean, I would really like to ask her and I'll try to understand what's her goal or what is she trying to achieve.
Can you repair that though afterwards?
You can. You could repair it. It's going to be more expensive repairing it than creating it, but definitely you can repair that. Okay. Oh. Of course. Innocent eyes.
Oh yeah, she's not Black China anymore. Now she's she went back to her original name.
That's right. Okay, another one.
I think he a one. I think I gave him a one because I think he faced it.
Oh.
Oh.
And he looked good.
Alright, watch your mouth.
Oh.
Tell me that what happened to her face.
You got surgery.
When are we gonna get a party? Whoa. 7.5. I can't see it.
Oh my goodness.
Oh no. We're gonna go crazy here.
Send that person, okay? Okay.
What the hell is that?
Oh wow.
Kids are ruthless.
I would say you're gonna get the most honest opinion out of kids.
You know who always looks really good and seems like they never age? Kris Jenner. I feel like she just always looks amazing. She's
Yes.
admitted to having a facelift though.
Right.
But I mean, you would never know because she just always looks so good all the time.
And I think it's a good combination of having good genes and having a good surgeon.
Yeah.
So I think those two need to
That's
come
the trick
together.
to life, to always looking young. Okay.
Exactly. I would agree with that.